Um, my name is Samuel Sane. I want to welcome you to our interview together with my friend and a great doctor, one of the senior doctors in South India, Hyderabad. My friend, Dr. Nagendra Parvataneni.
Yeah, right.
Doctor,
Yeah.
say hi to my people.
Hello.
Introduce yourself.
Yeah.
They want to know you.
Yeah, I'm Dr.Nagendra Parvataneni and I'm a surgical oncologist.
Yeah.
So I've been to East Africa multiple times. I've visited Tanzania about 4 to 5 times. I've been to Kenya about 4 to 5 times. I've been to Uganda. I've been to Rwanda. I've been to Zambia. I've been to Ethiopia in the north, and I've been to Sudan. So I've traveled more of the East African countries, and I've made few visits to Mauritius, although it's not in the African continent. And I have about 24 to 25 years of exposure in cancer treatment, and I've been in cancer treatment since the year 1998, and it's been a long journey. And that's it about me.
Wow. Most of the people know oncology is about cancer. I would like you to elaborate more about oncology as a surgical oncologist.
As a surgical oncologist, okay. Let me put it this way, since we have a specialty branch back home in India and not in the East African countries, wherein the general surgeons or the colorectal surgeons or the breast surgeons, there's a little diversification as far as Africa is concerned. But if you come to the subcontinent India, we have something called surgical oncology as a super specialty. And there are a lot of studies which have been done in North America, that's predominantly US and Canada, wherein they have taken a big subset of patients who have been operated by general surgeons, that is colorectal surgeons or the head and neck surgeons, and another subset who have been operated by the surgical oncologists. But overall, what we saw is the outcomes of those patients who have been operated by the surgical oncologist is fared far better than those who are specialized after general surgery in treating colorectal or head and neck or in gynae cancers. Mm-hmm. So I think in due course, or it's already taken off, surgical oncology is the specialty to treat surgical treatment of cancer patients.
Wow, that is great. Doctor, how many types of cancer have you ever treated so far?
See, surgical oncology, it's not just about me, about all my colleagues, as we do operate from head to toe, and the only organ that we do not usually encounter or we are not involved is the brain surgery or the spine surgery. Although I have done a few of cardiac surgeries pertaining to the tumors, but I have not, we have never been exposed to brain, although we are exposed to skull-based surgeries.
Why not brain?
So brain is a different subset of surgical specialty, which requires a lot of commitment, and you should be so good in your anatomy, and a lot of patience is required, and that's an altogether a different department.
In case a patient has a brain cancer, who will treat this patient?
See, the brain tumors, most of them are treated by the neurosurgeons.
Neurosurgeons.
Yes.
So it's good to know, because most of the people, you just go to any doctor, you want to be treated, you don't know what kind of a specialty the doctor has. I would wish you advise my fellow Kenyans, Africans, Tanzanians, Ugandans, everybody on how to go about it.
See, like I've said, the case does not come to oncosurgeon or to the neurosurgeon straight away. Usually what happens is these symptoms and evaluation initially are done by the primary family physician.
Yes.
So you tend to go when you're not well, let it be abdominal discomfort or a headache or a brain tumor, you tend to go to a family physician who does the initial evaluation and then sends it to a specialist doctor if he is not able to handle.
Yes.
And usually the specialist doctor is the one who will come up with the diagnosis. Okay, this patient is complaining about abdominal discomfort or pain or bloating or other abdominal symptoms, and come to a conclusion, yes, this patient has stomach cancer or this patient has a colorectal cancer.
Yes.
Similarly, evaluation is also done for the brain for various symptoms, and they come to a conclusion of a brain tumor.
Yes.
So what really happens here is the primary physician and the specialist have already diagnosed a particular patient with what he or she has, and then it comes to the tertiary a specialist like me or a neurosurgeon. And this is usually a segregation is already done by a super specialist.
Oh, wow, that is good. Okay, doctor, in your specialty, what kind of medical equipments make your work easier? Starting from diagnosing and also treatment.
See, as far as cancer is concerned, you should divide the tests or everything into two different aspects. One is screening a patient on a regular basis, whether the patient has cancer or not, and testing a patient when there is a suspicion of a cancer. Yeah, we do have a lot of state-of-art equipment back home in KIMS here.
Yes.
For diagnosing or treating any kind of cancers. See, if you take the newer modalities which have come up in cancer treatment or investigating cancer treatment, I think there is no end to the talk. But just to simplify it, as far as the imaging is concerned, it's a high-end MRI or the PET scan, or you have the 3D digital mammographies. This is the tomosynthesis tomography. All these are a few new things apart from the various other pathological developments that have happened in the recent times.
Wow. And when you're doing your surgical work, what kind of equipment do you use?
See, surgical, again, the armamentarium that we have in the surgical OTs and KIMS, I think we have state-of-art equipment. We have completely full-fledged equipment as far as both oncology or neuro-oncology is concerned. And the topmost what we talk about is the robotic equipment. We have a robo in our hospital, and I'm a robotic surgeon, and I keep using the robo quite often for all abdominal surgeries and at times for the thoracic surgeries and for oral surgeries. And as far as the neuro-oncology is concerned, we have intraoperative CT also to check if you have removed the brain tumor in toto or not. All these equipment are not available in every hospitals pan India or pan Asia. Very few hospitals have the state-of-art equipment.
Now, doctor, there is this method of treating or doing surgery, laparoscopic surgery. What is it?
I didn't get your question.
I'm asking, what is laparoscopic surgery?
See, the broad term given for these is minimal invasive surgery. So, in minimal invasive surgery, it could be a laparoscopic surgery, or it could be a robotic surgery, or it could be something like what I have done in your patient, that is VATS. It's called video assisted thoracoscopic surgery. And so, opening the thorax in a very big manner, which causes a lot of pain, we give a very small incision, and we put a lot of other instruments from other angles and a video, and that I'll be watching on the monitor and I'll be doing the surgery. So in Richard, what we have done is something called a VATS surgery, so which is also a form of minimal invasive surgery.
Now, concerning this case of Richard,
yes.
What kind of a cancer was that?
See, Richard came to me with a lung mass. and he had already received chemotherapy back home in East Africa, and he was termed as though he was not responding to the chemotherapy, and the scans that he had come with were not sufficient enough to throw light whether it is because it was a huge mass, and it was very close to the vessels which were coming out of the heart. So we had to repeat the investigations all throughout, and after the scans we did find it was very advanced, and the operability was doubtful, and I did talk to the patient attendants, Richard's his nephew or someone, and I did tell him that there is a 50-50 chance of not able to remove the tumor, and also there is a risk of death on the table. But,
death of the table.
Yes, but Richard was quite a courageous person. He said, I want it to be removed, and he became a little personally attached because of the translator that we had with us. And he's a tough guy. And
he's a fighter.
He's a fighter,
True.
I would say. And we did have anxious moments during the surgery, but at the end of the procedure, we were quite happy that we could remove everything in him. We initially had a contemplation that we may even have to open up his pericardium, that's a little bit of the heart, to get access to the vessels to give good margin. But he was lucky enough that we didn't have to do that part. But the most surprising thing that what we have noticed in Richard is he had come with a test of a certain kind of cancer. All lung tumors need not be one kind of cancers. And he was being given chemotherapy for that particular kind of cancer. But what we found out was he was having altogether a different kind of cancer, and that's the reason why he was not responding to the chemotherapy back home in East Africa. And now he has to be restarted with a different kind of a medicine now, after he recovers totally.
I learned you did what you call pneumectomy.
Yes, it's called a pneumonectomy. In Richard, what happened is of late we rarely do pneumonectomies. In Richard, what happened is the cancer was, as we take air, as we breathe in, it goes down, it divides into left and right. And from there, the trachea, the bronchus and all divide multiple times. So in Richard, what happened was the main principal bronchus is involved. And along with the vessels at the lung hilum. So we rarely remove the whole lung at times, but most of the times what we do is removing a part of the lung. It's called a lobectomy. But in Richard's case, we had to remove the whole lung because we had no other option.
No, he's surviving on one lung.
On one lung. See, surviving on one lung, for a person like Richard who is in his early 40s, it's not a big thing. He will recover well. He will do all his normal activities. He doesn't have to worry that he is on one lung except for taking care of not to smoke. And there are certain lifestyle factors which cause a compromised lung in a long run. So he should avoid smoking, exercise regularly, and slowly build up his lung capacity.
Now, what have you done to protect other parts of the body from the initial cancer from spreading?
See, I have not per se done anything. He had taken chemotherapy back home. But since it was a very bad disease, we wanted to do a complete evaluation from head to toe. If the disease is already spread to other parts of the body, there is no indication for surgery. So what we did was, first we did a PET scan, and we found out that the disease was confined to the lung. So that was when we thought, okay, let's give our best, try to remove that since it's not spread anywhere.
Wow. He has a good life to live and take care of his children.
Here he has a good life to live. And we were surprised, and we should have actually anticipated, because such a big lung mass not spread anywhere in spite of not responding to chemo itself, we should have got a doubt, or the doctor back home in Africa should have got a doubt that they're dealing with some other kind of a cancer rather than the routine kind. So he should do good.
Sincerely speaking, doctor, I'm proud of you.
Oh,
for
thank you.
what you are doing, and actually encouraging someone who is there, seated there, not knowing what to do. There is an issue here. I would like you to tell us. There are so many types of cancers and also stages. At what stage are you able to treat cancer patient?
See, it all depends on the organ that we are talking about, whether the stage of breast cancer or a stage of a prostate cancer or a colorectal cancer or a lung cancer. So since we deal with more than 100 subset of cancers, it all depends on stage of that particular organ.
Yes.
But usually on a broad spectrum, if you say early the stage, operability is definitely there, and the outcomes of the disease or treatment would definitely be good.
Yes. Doctor, this is actually encouraging, and sometimes you think you have come to end of your life. Now you have given Richard another life to live, and may God bless you and help you more to help so many people.
See, here in case of Richard, the treatment doesn't end here. What he needs to understand is, yes, someone has removed everything what he had seen with his naked eye.
Yes.
But he needs to take subsequent, it's called adjuvant treatment. The treatment follows. And he needs to take that completion of the treatment for him to become, yes, now I am cancer free.
Yes.
I have done my job, the doctors have done their job. Now I leave it to God whether he wants me to, how long my life is going to be.
True.
So unless you have completed your part of treatment, you can't anticipate, miracles or good results.
Yes. Wow. Doctor, maybe you have encountered one of the complicated case ever since you started your specialty. Which is this case?
See, I did come across a lot of very peculiar cases, starting from operating on a 3-year-old boy or 8-year-old girl with a huge abdominal mass. We did have a lot of, very rare cases. But there was one patient who had become personally attached to me. Over the period of 10 to 12 years, I operated on a cheek cancer for this man. So we had removed the cheek, and we had done a reconstruction. So 3 or 4 years down the lane, he came back with involvement of the jawbone. Then we went ahead again and removed the jawbone and subjected him to radiation, because that was the time when he had to take radiation and chemotherapy. Then again the patient came back with opposite nodes. So we treated on the opposite neck. And all this was happening over a period of 10 to 11 years or 12 years. Then we thought the patient was absolutely all right after 6-7 years. And recently he came back with a huge lesion on the chest, the bone, the bone. And we had to remove that bone because he didn't spread anywhere else. And we had to remove that bone and then cover up the bare chest wall. And over a period of time, you get attached to these kind of patients over a long run of 10 to 12 years. This is one very peculiar case where the entire family became very attached to me. I have seen his kids starting at about say 10 or 12, and they got married, and then they came back with their father for multiple treatments. They're very. I did have a lot of peculiar cases because it's been a long career.
Okay. Doctor, do you do research on cancer treatment?
See, research, we don't do particularly any kind of research on cancer or cancer patients, but we are involved in doing a lot of our publications just to showcase something that what we are doing good work. And second thing is, such papers are always useful for my colleagues who are going to face the same kind of a rare case or something like that. In India, doing research per se and spending a lot of valuable time on resources on research is still not, you know, there are certain institutes, yes, who are doing clinical research, but not here. I'm not involved in any of the clinical research.
Okay. Doctor, you are senior consultant and head of Department of Oncology. For how long have you been working with KIMS Hospital?
See, this is my 9th year in KIMS. When I finished my career, I started working in the same hospital. Then I moved to a government setup, wherein I worked for about 6 to 7 years. Then I worked in another corporate hospital. Before that, I've been to England for learning colorectal surgeries.
In England?
England.
UK,
Yes.
Western countries.
Yes. And I did spend some time in Tata Cancer Hospital for head and neck surgeries, which head and neck Tata Cancer is very popular for it. Then I did go to Taiwan to see how breast reconstruction, oncoplasty is done. So yeah, it's been, I did travel a bit to learn, to pick up the new modalities. When robotic surgery came in as one of the modalities, I did travel to the US, spent some time in the US. I spent about 4 weeks in the lab learning what robotic surgery is.
Wow.
But those days it was different, that you had to learn every bit of it before you implement.
Yes.
But the advantage now the younger generation have is they can see what the senior is doing and then learn. So we didn't have that opportunity of watching someone and then implementing it.
Yes.
So yeah, long career.
It's a long journey. Thank you, doctor. There is something you have said about, and I have also seen some from your office, oncoplastic. What is this?
See, now what is happening in surgery overall is, now with the advent of newer drugs and other modalities of cancer treatment, the surgery which was given the main preference, mainstay, and doing supra-radical and radical surgeries, now it is coming down slowly. So in each and every organ you have organ preservation, it is called.
Yes.
And wherein it was applicable for only a few previously, now organ surgery has become the need of the hour for most of the organs in that we are dealing with. Similarly, when you do coming to oncoplasty, when you're doing treating a breast cancer patient, you are removing the entire breast.
Yes.
Previously. Now that is the amount, the kind of surgery we are minimizing it. And oncoplasty is one of such procedures wherein you remove the affected part of the breast and reconstruct the breast in such a way that the breast looks almost, it cannot be similar to the opposite breast since we have handled it, but somewhere close to it or acceptable levels.
Yes. Wow. No, as we conclude, what is your hobby?
See, traveling is my hobby, and I like a lot of water sports, and I've been a sports person since I know my active life, and I do spend a lot of time in badminton and tennis whenever I get a chance. I think I'm out playing at least 5 days a week. There's no hobby as such, but yes, I like traveling.
Wow. Okay. No, in India, I saw most people like using simple mode of transport like scooters, motorbikes, and other, we call them in Kenya tuk-tuk, auto.
Yes.
No. What do you like using when traveling, motorbike?
See, I'm scared of motorbikes because I had my share of troubles in the past. Otherwise, I was using a motorbike in my college days. Now I use a car, and in case I don't have a car, like you said,
Yes.
my next and I mode of transport is an auto. I don't call for a cab. I like traveling in an auto where there's open air rushing in. Yeah, auto is much better than a cab, I would say.
Wow, that is great.
Barring the pollution that you see nowadays, I think auto is the best mode of transport.
True, I agree. And they are all over here in India, especially South India, Hyderabad.
You get an auto in every nook and corner in India.
It's true, true. I know you drive Suzuki because everybody here, most of the people here in India, you drive Suzuki or Mercedes. No, not Mercedes.
Suzuki, yeah.
Suzuki is your favorite car?
You mean what I use?
Suzuki, yeah. Yeah.
See, I use a Merc.
Merc?
Yeah.
Merc?
It's a GLS. It's an
That's
SUV.
Mercedes.
Yes, that's
Because,
a Merc. Yeah.
Yeah, you need a good car like that, which is safe. We need to see you more so that you can treat patients. Also in the world, because
no, why I have chosen a bigger vehicle is weekends we tend to travel to 2-tier, 3-tier cities for giving for a CME program, delivering a lecture, all these things.
Yes,
the safer car is what.
Yeah, you need a safer car. You need Mac or Volvo and other great machines. Yeah. Thank you so much. I do appreciate.
Yeah.
And as we wind up, I would like you to talk to a young man or a young woman who is there, who need to be inspired to be a doctor or a nurse. I would like you to advise this young generation.
See, I think principally I tell all my students or anybody who I come across is, if you have taken this profession of a service to mankind in the form of a doctor or a nurse, I think one thing that you should imbibe in yourself is patience and humanity, care, and there are a lot of other things which come with continuous discipline. If you don't have that care and compassionate feelings for your patients or for patients' relatives, and the first thing is there's no point in taking up this profession.
Wow.
So the patience, compassion, and dedication, I would say, are very important for a youngster to develop as they age in the profession of medical services.
Wow. Thank you so much for watching and listening to Dr. Nagendra Parvataneni. He's one of the most respected doctor here in South India and mostly Hyderabad city, working with Kim's Hospital. May God bless you, and don't suffer there. He's there to treat your condition, and all shall be well. Thank you so much.
Thank you.